How Liraglutide, Victoza, is transforming diabetes management. Step into a world where diabetes management takes on a new rhythm, orchestrated by Liraglutide, also known as Victoza. As we journey through its intricate pathways of action, personalized dosing, and careful precautions, we'll uncover how this GLP-1 agonist is rewriting the playbook for type 2 diabetes care. Indications: Liraglutide, Victoza, stands as a pivotal pharmaceutical ally in the management of type 2 diabetes mellitus. It is indicated for patients seeking enhanced glycemic control who have not achieved satisfactory results with oral antidiabetic agents. Mechanism of action: Liraglutide, a member of the glucagon-like peptide-1 receptor agonist, GLP-1 agonist, family, orchestrates its therapeutic dance through multifaceted mechanisms. By binding to GLP-1 receptors, it stimulates insulin secretion in response to rising blood sugar levels. This synchronized insulin release curbs glucose spikes and fosters postprandial glycemic equilibrium. In addition, liraglutide suppresses glucagon secretion, delays gastric emptying, and promotes satiety, all of which contribute to sustained glycemic stability. Dosing: adults can commence with 0.6 mg daily, subsequently advancing to 1.2 mg and eventually to the optimal dosage of 1.8 mg. Dose titrations: gradual dose titration facilitates personalized glycemic management. Starting with a lower dosage and incrementally increasing, it allows the body to adapt to liraglutide's effects while minimizing adverse effects. Adverse effects and management: nausea and vomiting, common upon initiation, these effects often diminish with time. Gradual dose escalation, smaller meals, and acclimatization aid in their mitigation. Diarrhea: adjusting fiber intake and staying well hydrated can alleviate this symptom. Hypoglycemia, particularly when used alongside other anti-diabetic agents. Monitoring glucose levels and tailoring concomitant medication dosages can prevent hypoglycemic episodes. Injection site reactions: proper injection techniques and rotation of injection sites reduce discomfort. Contraindications: liraglutide is contraindicated in cases of hypersensitivity to the medication or its components. Additionally, individuals with a history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, MEN2, should exercise caution. Use in special precautions. Renal impairment: careful monitoring and dose adjustments are advised in patients with renal impairment. Thyroid C-cell tumors: caution should be exercised in patients with a history of thyroid C-cell tumors or a family history of medullary thyroid carcinoma. Gastrointestinal disorders: patients with gastrointestinal disorders might experience enhanced gastrointestinal adverse effects. Liraglutide emerges as a remarkable therapeutic strategy in the management of type 2 diabetes. Its diverse indications, intricate mechanism of action, tailored dosing for various age groups, and meticulous adverse effect management showcase its multifaceted approach to glycemic control. However, individualized care remains paramount. Consult healthcare professionals to calibrate the treatment to unique health considerations, embarking on a journey toward comprehensive diabetes management and lasting well-being.